Dhamodharan, you can unmute yourself. Please unmute yourself.
Very good evening, sir. Today my topic is about anesthesia information management system. Introduction. Definition. The anesthesia information management system is a computerized system that collects, stores, and presents perioperative patients' data, mainly preoperative, intraoperative, and postoperatively. Why it is important? It is a traditionally anesthesia records are handwritten, prone to omissions, illegibility, and retrospective entry. The aims ensures real time, accurate, legible, and permanent records. Context components of aims. It has two components, hardware and software. Hardware is nothing but of our workstation with computer, networked monitors like ECG, pulse oximeter, NIBP, BIS monitoring, etc. And server for central storage and backup. Software modules for pre-op, intra-op, and post-op documentation. Decision supports tools such as alerts, drug dose calculators, etc. Integrations with hospital, the data, and third is the data captured by aims. It's in preoperative, we have demographics, history, allergy, ASA, and airway assessment. Intraoperatively, it records continuous vital monitoring of heart rate, BP, saturation, ETC, O2, and temperature, anesthesia agents, dosages, routine, and timings, how much fluids we are giving, and blood products and urine output, events, intubation, extubation, regional blocks, and invasive lines. Postoperative, it records back to PSU handover. Advantages of aims. It has the clinical accuracy and patient safety. It has a automated time-stamped data capture. It reduces the missed entries and alerts for hypotension, desaturation, and drug overdosing. And it also provides medical legal protection, complete tamper-proof record, often HPPA and GDPR compliant. Quality assurance and research. It facilitates the audit, benchmarking, outcome reporting used in large-scale data analysis, supports evidence-based anesthesia. Resource management. It tracks drugs and consumable use, helps in billing and cost analysis. What are the limitations and challenges we faced in this aims? This first one is the cost. Initial investment will be very high for the software, hardware, and maintenance. Training, anesthetists and nurses need adaptation, risk for reduced vigilance if over-focused on the screen. Technical problems, downtime, integration challenges with data overload. Too much information may hinder clinical decision making. Confidentiality concerns, mainly compliance with HIPAA and medical legal issues if data is breached. Evolution and future trends. Evolution. The paper, it's isoelectrical electronic records to network. While now we are recording in paper, from that we are converting into isolated electronic records to that the networked aims and fully integrated perioperative. Future directions, AI and predictive analytics, forecasting the hypotension, hypoxemia, closed loop system, automated drug delivery, ventilator adjustments, cloud-based aims, universal access, useful for resource limited settings, integrated with national database, quality benchmarks, and outcome improvement. Clinical conclusion, the aims, it's a modern backbone for the anesthesia practice. It offers accuracy, safety, and medical legal protection and research opportunities. The challenges remain cost efficiency and adaptation is inevitable. Future, it is the AI-driven, cloud-based, integrated perioperative information systems. Thank you, sir.
Okay. So the word anesthesia information management system itself is self-explanatory. That earlier when anesthesia was started, People were just giving anesthesia. If you see the evolution of anesthesia through ages, it all started. What was the earliest method of providing general anesthesia?
The paper.
Historically.
We start writing in papers, sir.
No. What was the method of administering anesthesia during the early stages of evolution of anesthesia? When they found out inhalation anesthetic agents like ether, chloroform, what was the method of their administration?
The simple suspension mask will be used, sir. The mask will be used.
What was the mask used?
I couldn't able to pronounce it, sir. Simpulsion.
It's called Schimmel Bush mask.
Yes, sir.
It's a metal frame,
Yes,
the
sir.
cloth over there, and they
Yes,
used to pour the anesthetic agent, especially ether. And earlier to the ether was to chloroform, then only ether came. Why ether replaced chloroform?
Oh my days.
Anybody else? Not interested in history? Ranjani, Bindu. Chloroform naturally had some complications. It produced ventricular fibrillation even in young individuals and cardiac arrest. There were so many deaths because of that. Whereas ether was safe on the myocardium. It was not that dangerous. So people replaced usage of chloroform with ether by open drop method. Why the modern anesthetic agents cannot be used like that? Why can't you use sevoflurane or desflurane or isoflurane as an open drop? Other post-DA graduates were there. Anusha, doctor, are you there? Dr. Kamal, you there?
Sir, maybe these are saturated vapors.
That is related to saturated vapor pressure only. Okay. So the high saturated vapor pressure will produce a percentage of 22% of sevoflurane if you use it as a open drop, just like ether. Okay. So 22% of sevoflurane, if it is administered to the patient, what will happen? He'll have immediate cardiac arrest because the myocardial depression will be so much. Okay. That is the reason why the modern anesthetic agents require very specific calibrated vaporizers. So during that time, they were just administering anesthesia and observing what are all the clinical changes. And then once the case gets over, they just let the patient and ask the nurses to look after. No documentation of any intra or post-op events were done in the earlier stages. And the first person to introduce documentation of the patient's vital conditions intraoperatively and postoperatively, who was that person? Was he an anesthetist or was he a surgeon? He was a surgeon.
Surgeon.
Dr. Cushing, who described Cushing's syndrome, Cushing's reflex. All the neurosurgeon, Dr. Harvey Cushing was the first person to ask a nurse to record the patient's vitals like pulse rate, blood pressure, respiratory rate every 10 minutes in a piece of paper and filed it along with the case record. So he was the first person to introduce the documentation of intraoperative patient's vitals as well as any intraoperative events, whether it is positive or negative events. Like he used to say, right now I am making an incision on the cranium, scalp, I am opening the dura, I am now finding the brain bulging out. So all these things he asked the nurse to note down and recorded that. So that was how the first anesthesia intraoperative information system was started. And then there was another person called Noseworthy who made a regular thick cardboard paper chart where he printed all the details that have to be recorded instead of writing it with the hand individually. So there was a column to say name, age, sex of the patient, IP number, pre-op diagnosis, surgery, everything was given a blank space so that you can just fill up that, and the recording system was made a little more easier rather than the mundane, difficult way of writing each and everything. And these charts were used and compiled to then make a post-op audit of whether anything went wrong. They can pick out those cards and say how many cases of tonsillectomy had aspiration, how many cases of tonsillectomy had laryngospasm after extubation, how many cases of tonsillectomy had post-tonsillectomy bleeding. Like that, each and every individual surgery, they could do get the information and do some analysis or audit and introspection. Then came your advanced method of, so gradually this sort of record keeping improved little by little, and with the advent of computers, we have become more lazy. We have to just feed the data and sit quietly with the patient, and everything will be taken care of the computer, and minute to minute variations in the patient's vitals are all stored in that machine. And then if you want, you can take a printout and then look into that, or it will be stored always in the data system of the machines, and then it will be done. So from intraoperative storage of information, this gradually went on to the preoperative assessment also, to make sure whether what is the ASA category of the patient, whether he is fit for the surgery, what are the investigations done. So all the details were collected and stored in the computer in the preoperative phase. Then it transformed and went on to the post-operative phase, where the patient's vitals and the complications were all stored and recorded. So by doing all these things, you get the all the details that you want about the patient from the preoperative, intraoperative to post-operative phase. And this helps in reducing your physical strain of noting down everything, and also gives a permanent good record of all the events and the information about the patient. This is very useful nowadays to make an analysis, present a paper, or find out how you can improve your services and avoid complications in the future. Okay, that is what happened in the entire system of anesthesia information management system. Okay. And as you rightly said, why we are not adopting in each and every hospital? Because the hardware and software, the machines that are required to do this are quite expensive. Not all hospitals can afford. Of course, corporate hospitals with a lot of money, they are now able to do that. And if you see the evolution of your anesthesia machine, when we were postgraduates in 1970s, we started with the very simple basic Boyle's machine. Then it graduated to machines with more sophisticated vaporizers. Then once the workstations came into regular use, which was considered very expensive during our postgraduate days, now every hospital, even small hospitals, are able to buy the workstations with their automated ventilators and vaporizers, etc. In these machines, to incorporate the anesthesia information system has become more easier, because most of them are electronically operated and they have a computer-based system in that. So this helps in the recording of all the information that you want by feeding the data, and then all you have to make an entry, then automatically it will record the whole thing, and that will give you an idea about how to manage the patient in the post-operative system. So that is how the anesthesia information system has evolved, and that is what you have to mainly stress in your answer.